cannula or the LNG-IUS. Again, indications for LNG-IUS you should know. Okay, when it is used and what is the amount of drug which is here. What is the amount of drug?
20 every day.
20 micrograms every day. What is the 50? So those things you should know. Okay, and this is the push and pull technique. That is all they're going to ask you. They're not going to ask you how to demonstrate and all that. Most probably, if you answer everything, maybe they'll go towards that. This is that. What is this? This is the Bakri balloon. Okay, this is the Bakri balloon. Okay, it's called as the Bakri balloon. It is used in PPH, in controlling PPH. Okay, in cases of uncontrolled PPH in post-normal delivery, we can use this. This is the bulb which goes into the uterus, and this is the inlet. We have to inflate the bulb up to 160 to 180 ml. You can inflate the bulb. Okay, and keep the prevent the sinuses from leaking out. So this will prevent the sinus. Mechanism of this action you'll have to know. If the Bakri balloon is not there, what do you use? Foley's catheter. So that is one more use of Foley's catheter. Okay, they might ask what else Foley's catheter is used for in obstetrics and that. Okay, this is, they will connect it to an outlet where it will be the same Euro bag only, where you have to measure the amount of blood loss in that. Okay, it has a hole. Can you make out?
Yes,
this is where the blood seeps out through the tubing and it goes and collects in the back. So coming to the instrument, and this is a manual vacuum aspiration. Okay, these are Karman's cannulas which comes in different sizes. Depending on the period of gestation, we take different sizes. Okay, early the gestation, the smaller size we take. Okay. Again, suction, evacuation, abortion thing, just the basic procedures you should know. And coming to another OPD basic examination which we use, this is a speculum, and this is a vagina. So you will have to name the instrument and say about its uses, or describe the instrument probably. In such instruments, you'll have to describe the instrument. You'll have to say it has 2 blades. You can get a one-bladed sim speculum also. So in this instruments only will be kept for your exam. So it will be the same thing. Okay, 2-blade speculum, which is used to depress the posterior vaginal wall and visualize the cervix. Along with this, you need an anterior vaginal wall retractor, because it is not a self-retaining or doesn't have 2 blades. It has only 1 blade. Okay, so you will have to push the anterior vaginal wall with using the anterior vaginal wall retractor. Okay, so what else? Where else this instrument is used for? Again, for examination 1, then taking pap smear, taking endometrial biopsies, then using for colposcopy, vaginal surgeries. Okay, so all those things you'll have to name with this. Okay, then this is an anterior vaginal wall retractor, used to retract the anterior vaginal wall when we are visualizing the cervix. Also used for
lip of the cervix.
You cannot hold with this.
That is all.
Valsalum.
That is a valsalum. There is no valsalum in this one. Okay. This is also used for blunt curating post-delivery. Okay, because the os is thing and it has a blunt edge. So you can use it for blunt curating post-delivery if at all they ask you. These are basic instruments. If you pick up or if they give you the instrument, they will go to procedures, basic procedures they will ask you. So try and not pick up on your own. Okay, but is it remove to? If you are sure about procedures, then tell them. What is this? This is self-retaining speculum. It has 2 blades which retracts the anterior and the posterior vaginal wall together, and you can fix it with these screws. Okay, so when you are alone, you can do a pap smear, you can do an ED, everything using this. But otherwise, if you are using a SIMS, you need another assistant. Okay, so it's a self-retaining retractor used for retracting both the anterior and the posterior vaginal wall simultaneously. And procedures like pap smear and visualizing, the first is visualizing the cervix, pap smear, endometrial biopsies, colposcopies, all can be done without any assistant requirement. Okay. Anything else? This is the two arms where we open the blades so that the cervix is visualized. And how do you this is the most common question they'll ask for speculums. How will you introduce it into the vagina? Okay. First you have to go in the laterally and then turn. Once you go inside, you have to turn vertically. Should never forget. Even with the Sims, same thing with the Sims.